honor to proclaim that the month of April is Autism Awareness Month in Minnesota. I have a nephew who's autistic, who was diagnosed when he was about 3, he's in his early 20s now, so I know what it's been to my sister and her life, and how it just took over, really. And so I have such admiration for all of you parents and young people who are looking for support and assistance which you deserve, and looking for hopefully a cure sometime in the very near future, which also needs the financial support to come about. So I was admonished for a blue tie today, and with a blue tie on. Little lights emanating from the governor's residence later on this evening, and anything I can do to support it, including supporting the state legislation to provide for the part of the private insurers to provide coverage. One story here about someone who was receiving coverage through health insurance and then suddenly is going to be cut off on July 2013. Not for medical reasons, but for financial considerations on their part. You know, that's the whole problem with one of the major problems with our private insurance system in Minnesota and across this country. You know, young families, when you go from being a young single person to being a young married couple, and then you start to have children, that's often when individuals make a decision to not have health coverage, because they're trusting they won't get sick, and it's expensive to having coverage for their family, especially their children. And I don't think anybody knows when before the children are born, you know, what medical treatment they may need in their years. Nor do we know what we need ourselves. So you get a situation where you buy a health insurance policy and you're paying into that policy, and you assume that that means that you're covered for what happens to you and your family. And then when it happens, if it happens, the insurance companies bail out. You know, they're not such good neighbors when it's kind of their turn to pay their services. And the other factor is that the interlock of these public-private coverages, private insurance, medical assistance, which we're proposing to increase funding for early intervention of autism, but you have to access that program if you're on private insurance, and you know, I mean, you have to have PhDs in government practices, which I don't want to force that anybody. So I sent a letter today, signed a letter that goes to the director of the CMS in Washington, urging that the basic plan for Minnesota include autism treatment services. I support Senator Tavis's legislation to bring about a state requirement that insurance companies have to provide these services. And those who say that we shouldn't be mandating these as the private insurance companies need to look at stories like this one. And somebody just gets arbitrarily cut off on July 2013, their expenses continue. The insurance companies just decide, well, we're not going to pay for it. There was a burden you nod your head, and Senator Carlson and Senator Tavis and all of the people who have championed this legislation understand that real Minnesotans and with real lives and you know, real world incomes can't afford to carry this on by themselves. And that's why they get up, take insurance, and that's why their insurance will cover them when it's needed. And if the insurance companies won't do that, then we have to do something about it, which is why the legislation is necessary. So it's my honor to announce today that this is Autism Awareness Month. And thank you for your leadership. Thank you all.
Dayton. Your support of families living with autism means so much to us. My name is Kramer, and I serve as the Family Services Community Liaison for Autism Speaks in Minnesota. But most importantly, I'm a mom. My husband Tom and I are very honored to be here today with our 3 children, Elliot, Henry, and Ada, who's really short. Both Elliot and Ada are on the autism spectrum. 2013 marks a decade of autism for our family, as it has been 10 years since my son Elliot's diagnosis. I will never forget that day, walking out of the clinic with my sweet little boy, holding a piece of paper that would change our world forever. It was just as painful 5 years later when our lovely little girl started exhibiting some of the same early warning signs that were all too familiar to us. What I remember most was the isolation that we felt and the parental guilt that we had for not knowing instinctually how to help our children. While we have faced many challenges through the years, we are very lucky. Our children were diagnosed early, and we have been able to do intensive behavioral therapy programs for both Elliot and Ada, which have been life-changing for our family and given our children the opportunity to live happier, healthier lives. This year, more children will be diagnosed with autism than with AIDS, diabetes, and pediatric cancer combined. Families will be overwhelmed, siblings will be impacted, marriages will be strained. Yet, autism receives less than 0.3% of NIH funding. The face of autism is changing. Children grow up to be adults, and in the next 10 years, we have a wave of young people with an array of strengths and challenges that are coming of age. Currently, there is 81% unemployment among adults with autism. I believe we can do better. With free resources from Autism Speaks, such as our employment toolkit or the 100-day kit for families that are brand new to autism, we hope to assist families and individuals with autism to create meaningful, respectful lives as adults. Each April 2nd, Autism Speaks celebrates Light It Up Blue in commemoration of World Autism Awareness Day. We hope to shine a light on autism and improve the lives of all those on the autism spectrum. 10 years ago, I could never have imagined all that our children have been able to accomplish. As a mom, I am most proud that they are beginning to advocate for themselves, even when it's hard. Tonight, we are very proud to join Governor Dayton in lighting it up blue, and we hope you will too. Thank you, and my son Elliot has a very brief message for us.
We're lighting up the day at your house tonight.
Governor, the children have a couple of gifts for you.
Lily?
Oh, there's a little light already. I'll put that in my office here. Yeah. Oh, yeah. All right. That's really special. Thank you very much. All right, okay. Put that on today and then tonight too. Okay? Thank you very much. She has a gift too, okay? Let's go over here so they can see. So let's go over here, Rita, so they can see. Come on, over here. There we go.
Who's that for?
There's my dog. You did? Wow. That's really, that's my grandson. He was born last week. But before that, I had a picture of my dog. There's Mingo and a Testy. There's my old guy. And beside. So there's Mingo and the Testy. They will love the bones. Thank you very much. Okay, this is oh wow, a blue bear. All right. You know what I'm going to do with this after tonight? I'm going to give it to my grandson. I'm going to give it to my baby grandson. Yeah, no, thank you very much. Thank you. Thank you very much.
the group on Light It Up for the day. Oh, we're good, all right. So you want to
You
do
want to
this
go
one?
if you're there, there's another